if you win the by-election, one of the big devolved issues that you're going to have to contend with is the NHS. Now, locally, there's lots of complaints and fears about the downgrade of the neonatal unit at Wishaw Hospital. Will you oppose that downgrade if you're the MSP?
So this issue for me, and I'm going to speak here as a parent as well, and from the heart, this issue is about making sure that the smallest and the sickest babies have the absolute best quality care. And what it comes down to, for me, I would crawl over hot coals for my children. I have worked with children and families and young people for my entire professional life, from the absolute beginning, in different capacities. And the one thing that has united every family I've spoken to is they want the absolute best for their child. It doesn't matter what their circumstances are, and they would do anything to make sure that would happen. And if they thought if their child was extremely ill, had health issues, which of course you see it as a teacher as well, health issues that can follow a child for their life, and it's all about making sure that they get the support they need. People would fly to the moon if it was the best thing to do for their child. The staff in Wishaw do a fantastic job, an absolutely incredible job, and I would like to put on record my thanks to them. This is about a very small subset of families where their child is needing that extra support, and it's only for a temporary time. There is funding in place to make sure that they have absolutely everything that they need when their family is going through what is an incredibly difficult time for them, to help them with some of the practicalities about getting there and so on, to make sure their family feels supported. And of course it's about getting them back into their communities and back into a more local hospital for them. But fundamentally, the science, the experts, the medical research tells us the best outcomes for these children, which will affect them for the rest of their life, for these very small and sick babies, is to have them in a specialist centre. And as a parent, that's what I would want for my child.
So you for or against the downgrade?
It's not about being for or against the downgrade, it's about doing the best for those children. And if the research is telling us, I'm not a clinician, I've never been, and although in my family you're either a teacher or a nurse, that's the two paths we choose. I'm not a clinician, I'm not going to sit and make medical judgments. I will listen to the expertise of people who have made those medical judgments and who have advised the Scottish Government on what is the best thing to do here. The best thing to do is to have a specialist centre where the best equipment, the best, when you're dealing with something which is affecting such a small subset, then that's what I would want for my own child, and that's what.
Wouldn't a local champion oppose the downgrade though, given the local resistance to it?
A local champion would make sure that families are supported in the best, to give the best outcomes for their children, and to make sure that they're supported and that they're back in their communities, they're back in their support network as soon as possible.